My name is Anita Menderotta, and I'm honored to be the Special Advisor to the Secretary General of the UNWTO. Thank you for joining us for Hospitality Gives. I'm delighted to be here with Jonathan Worsley, who is the founder and the chairman of Bench Events and a co-creator of this very special project. What is Hospitality Tomorrow Gives? It is indeed a special project because this is a unique year. This is the program that comes together to bring together leaders from across the hospitality world, people that you and I all know from businesses and brands who have stepped up during this COVID-19 year that has devastated our industry to help frontliners, people in their own businesses or within the medical community around them, all the places in which they operate. These are the people who've shown us that stepping up is a vital part of all of us getting through. We're delighted to have with us today DILEEP Mudadeniya, who's the head of corporate affairs of Sri Lankan-based Cinnamon Hotels and Resorts. DILEEP, a very warm welcome.
Ayubowan, Anita. It's great to be part of your program.
Thank you so much.
Yeah, DILEEP, great to have you, and so interested to hear your inspiring stories. So over to you, Anita, for the first question.
Indeed. DILEEP, why don't you tell us a little bit about what you've done that really has been so inspirational and is unique in a way that a lot of other leaders have not actually been taking the idea forward. Please.
Yeah, so I think when this happened, I think we had we knew that, as a brand, we had to respond. And we actually firmly believe that it was not about brand distance, even though it is about physical distancing, that as a measure. So we've actually looked at it, as brands, the value chains have changed, the value propositions have changed, and we have seen certain brands like Pret a Manger in France and Europe and what they have done and how they've been achieved to a closeness and customer admiration aspect of the segment. So we've looked at it very carefully, and also we've studied actually what the stress level, which is this entire medical fraternity is going through. Unlike in other countries, etc., in Sri Lanka particularly, there is actually health workers actually play a critical component of our keeping our health playing an immediate role. The health service is free of charge in Sri Lanka. So it's public health, it's free of charge. And all the doctors, nurses, and supporting staff, actually, they contribute. And we have a huge network of health officers, which includes a midwife going to a pregnant woman in the village, a remote area. Today, I was actually in one of those remote areas in the jungle. I saw a midwife coming in a scooter, advising a pregnant woman on how to take care of the maternity. That's a level of public health, preventive health, and cure that has been in place. So we have seen that some of these people are unable to, they have to work right throughout, day and night. They sometimes can't go home as well because there's a safety reasons, and they had to go through emotional stress during the period. So we said the least that we can do as a brand. We had our hotels, and said we went and said, the president of the country and the rest of the health minister, and said, we'd like to invite your staff to our hotels and choose any hotels that you like. We had 14 hotels or 11 hotels in Sri Lanka operating. I said, choose any hotel that you like. We will host you. Not only that, we will make sure that you will have a good time. We will make sure that we'll have extra stress management sessions, speaking sessions, good food, and come with your family, not only alone, entire family and children. And we gave over 2,000 room nights for the health workers to make sure that they had a really good time with their family and colleagues.
That's beautiful.
Yeah, that really is, DILEEP. And is that program still continuing, or have they used up the 2,000 room nights at the moment?
Yeah, they used up the 2,000 room nights, and then also a good thing is that World Health Organization, who saw this program, also supplemented with their support, and we gave it more people, and then they also followed it. And then actually the program became such bigger element. So now as a result of that, even Sri Lanka Tourism and the rest of the hotel is also willing to actually follow that path and trying to offer us a few things. And that's under discussion. As we speak, the country, the second waves and the third waves are coming in. So the health workers are extremely, extremely busy and much busier than in the first wave. So we would like to see that, this is shaping up on the second and third stage. But the break that we gave, the recognition that we gave, and actually we branded it we basically call the local heroes and came a nice coin word in the local language, Sinhalese and Tamil, and create that recognition where actually big people actually recognize them. And also we did a prior to coming in, during their stay, they shared the videos, etc. So they became actually talk of the town, and also people got to know that who these people are. And that actually included somebody who cleans a toilet in a hospital into a specialist doctor who actually treated in the front line. So there's no absolute discrimination. And this is something, a very good example of public-private partnership, where the ministry, we work with Ministry of Health and a private sector leading organization, set in the stone and say that, we should recognize the very people who take care of our staff.
DILEEP, I love the way that your initiative has taken hold, and the industry is following suit. So it's a great initiative that you're running. Are the staff within your hotels, what are they doing for the frontliners?
So initially, when these hotels were coming in, the hospital workers coming in, obviously, I see first stage, they didn't know much about the virus. They were a little scared as well, because these are actually people who really dealt with positive cases. And so we had to go through a little bit of understanding sessions, telling them what it is. And then after that, actually, they were very appreciative of them. So we actually trained them to specially welcome them. Every hotel has a welcome name, a letter into that. They had a photo booth. Actually, they could come and interactively take a few pictures around. And they had music sessions. They had motivational speakers during the time. Some actually prefer total relaxation. They had good food that, normally you don't really, when the hotel is not running functioning full, you don't run sometimes in full buffet, etc. But even with 20, 30 rooms, we ran the full buffet for them. So we just gave the total experience during times. So the staff in our hotels actually we got them to change the mindset so that, we actually go extra step and to inspire them in every step of their arrival to the hotel.
It's amazing, DILEEP, what you've done. And I think what I find really interesting, and having had the blessing of being at your beautiful properties, 2 of them, when I was there last year with Richard Quest and the CNN team, one thing I love is that you've approached this from the point of view of mental health. And you've actually worked with the Ministry of Health to create this program, as well as the Ministry of Tourism, and looking at it from the point of view of not what many hotels are doing in terms of in the moment care of frontliners, but giving frontliners a place to simply recharge their own batteries and with the loved ones that they've been kept apart from because of risks of contagion when they were actually serving. It's interesting as well that you've also demonstrated how you've kept the hotels operational, which helps the mental health, exactly as Jonathan tapped into, of the staff. As we now look into the second wave that sadly the world is being faced by, are you going to be doing this again and running this again, or is there changes to the approach that's being taken based on what you've just shared with Jonathan?
No, I think we need to be innovative in all the time. So we shouldn't be doing the same thing over and over. I think we are looking at another innovative and exciting step of this. So it will be the discussion at the moment. But currently, the medical staff is extremely fully taken by the second waves, and then the taking care of a lot of expatriates coming to Sri Lanka, etc. So, but in the meantime, we work very, very closely with the Ministry of Health, and that has really helped a lot. What we do is actually, as we speak, we are turning into one of our hotels into what we call intermediary care center for the patients who are tested positive. And that gives extra rooms, that gives a little bit of flexibility for them. Because as you know, there's a lot of people who are tested positive, they are asymptomatic. They're like you and I. They don't see any difference, they don't see anything. So they don't have to be in a hospital, but they have to be in a care center for a certain number of days until actually they dilute the virus so that they can't actually spread it anymore. So that we have decided to turn that in one of these days. So it will be announced within the next 2-3 days. And so it's another extension of what we have been doing, so that we do a little bit from our part as a hotel chain.
Stunning.
That's great, DILEEP. I'd be interested to learn a little bit more about anyone within your team, within your greater team, that has just stood out as exemplary in terms of what that person has done for the community? Is there any stories you can share with us there?
There are few who did that. I mean, during this this period, I mean, I can't pinpoint one or two, but there are a lot of people actually who came forward during the first, especially on if you look at the first wave. People didn't have much information about this. They think it was lethal. They think if you get it, that's it, and that's like a huge pandemic going around, and you will get paralyzed. So many things were actually going around during that time, especially the general managers of the hotel, along with the key staff as a member, operational staff, because we sometimes decide from the corporate office, the challenge is actually deliver on ground. And they have to do a lot of things to make sure that, you know, they're comfortable. They were able to interact and engage with them. And then to ensure that, you know, they will actually don't feel out of place is something which is very important. Actually, it's heartwarming to say that some of the people actually were going to the hotel for the first time in their life. So we even actually had to print a document, etc., so that, you know, they were little not just to make sure that they are welcome and they don't feel intimidated by various things. So we changed that, changing that behavior in the staff, and then welcoming them from the bottom of their heart is something which I saw that the staff was taking extra step. And as a result, I think all the GMs and the staff of the hotels actually can be nominated as the key achievers of this program.
That's lovely. It recognizes beautifully as well, DILEEP, and this is what I've enjoyed about this conversation, that the frontliners in the business have their own fears about this pandemic. We've never as a world gone through anything like this before. And your approach has sensitized from that dimension. So before I hand over to Jonathan for the official close, thank you for being with us, because you've shared not just the really important information of how you've done it, but your why is beautiful. It really is lovely. And it's nice to know that you're going into a second round, as sadly the world goes into a second wave. So over to you, Jonathan.
Well, DILEEP, thank you so much for joining us. Thank you, DILEEP, for joining us and showing us your innovation and creativity when it comes to, you know, how we deal with this and how we motivate our teams and our staff, and we look after the community. And you're amongst other leaders that we are interviewing to really showcase, you know, excellence here. And we thank you for what you're doing, and keep up the good work. Challenging times, of course, around the corner as well. But I look forward to returning, as Anita does, to Sri Lanka. We ran the Sri Lanka Investment Conference a number of years back, and we very much look forward to doing that event again. So DILEEP, on behalf of Hospitality Tomorrow Gives, thank you very much for being with us today.
It's my pleasure, and I believe that, you know, that's very strong belief that in our country that we go through, that sharing, caring, giving, and compassion, the four cornerstones of a life or a business for the post-COVID development or post-COVID marketing.
Brilliant. DILEEP, thank you very much, and stay
My
safe.
pleasure. Stay safe, all of you. Thank you.
Bye.